96.9. Dirks Bentley, a tip of the cowboy hat to the late, great rocker Tom Petty and American Girl. Hey, let's go on the phone trip to the Family Care Center, Titus Regional Medical Center, and we are joined by Dr. Craig DeLisi. Hello, doctor.
Hello, Kerry. Good morning.
Good morning to you. Okay, I got to let you in on kind of what I watch and listen to a lot, and it's going to nerd me up a little bit. I watch a lot of the Business Channel and listen to some business stuff driving in to work and away from work. And for the last 2 years, all I hear about is generative AI, artificial intelligence, and what it's meant for stocks that are bringing that to everybody. And I'm just wondering now, with you in the mix here, what sort of effects AI has had and you anticipate will have on medical care, on health care in the U.S. Have you noticed anything? Is anything in place now with Titus Regional Medical Center?
So I don't think currently there's any direct impact that it's had day-to-day on my practice. I think that there is some technology that's being utilized that in certain places, especially as it comes to like medical charting, they basically have artificial intelligence programs that a doctor turns on when he walks in the room and then just has a conversation with the patient, talks as if he's, just taking care of the patient, not tending to a chart. And the program creates a visit note based on that and does the charting as if there was a scribe in the room. So it's considered almost like an artificial intelligence scribe. And I've talked to some people who have used it and said that it's surprisingly good. In other words, if you're talking about fishing, it's not putting that in the note, but when you're talking about the diabetes, it is. And then the doc goes in behind and does some editing, but doesn't have to compose a whole note. So that's definitely a potential, positive use for something like that. But we're not doing that at this moment, and maybe down the line that'll be something that everyone does. I do have some concerns about that, but I think that it's hard to know what ways it will have an impact on. I mean, every aspect of our lives, including healthcare. I certainly imagine a time when people are, kind of like they do now, putting their symptoms in and discussing, with the computer screen what they're having, and the computer screen's sort of generating what they think the diagnosis is, and I think that sort of thing is possible and not unhelpful. It could help with diagnostic accuracy and things like that. I think, like everybody else, I have concerns about the potential negatives for such things as we go, increasingly automated and sort of lose the human factor.
So let me go ahead and just kind of capsulize advantages first, then let's get to those perhaps disadvantages. So maybe improved diagnostics, precision medicine, certainly streamlining administrative tasks and workflow, stuff like that. But disadvantages, do you worry about potential job displacement?
Not displacement per se, but, I think that it could replace, certain aspects of care. I think there's pretty decent job security. I feel like, at least in healthcare, there's pretty decent job security because I think people really still need a human connection for their health. I think it's greater than, it's not just about diagnosing an illness and treating it with a medication or a disease being treated, or a surgical problem having surgery. I think that there needs to be a human connection and care where people are heard and understood, and things you deal with aren't always as simple as just figuring out a diagnosis. I mean, I had a patient here yesterday that is a gentleman I've taken care of for 15 plus years, and has been on dialysis for years, and is really just kind of at the end of his rope and tired of it and ready to stop and let his natural processes take his course, and he's ready to die. And he came in just to have that conversation with me, and I can't imagine a robot of any sort or any sort of artificial intelligence replacing that in a way that is really helpful for the health of humanity. And so I don't think so, but there probably are things, I think there probably are things that can help do better and do efficiently and make sure, help with medication errors and prescribing errors, which are still a big problem in healthcare just because of volume and busyness, that things get, misprescribed or prescribed, slightly wrong or whatever. So I think there's lots of places that could clean things up on the back end. But gosh, I can't imagine a day where we're only talking to a screen and there's not a human involved. I feel like that would be unfortunate if we end up at that place.
So if there ever comes a Tuesday morning in which I pick up the phone and I see it's Titus Regional Medical Center and the Family Care Center, and it's, "Hi, this is Dr. Craig DeLisi," I'll know something's up. You've been replaced by AI.
Yeah, I mean, I've seen AI preaching sermons. I've seen that done. So who knows? So if it seems a little fishy, whatever we're talking about, if I'm on repeat or something, then let me know. Text me so I can tell you if it was me.
Dr. Craig DeLisi, in human form, joining us this morning, talking about AI and maybe some of the advantages and disadvantages as it gets more and more in time. I think it'll be adapted by everything, including healthcare. I appreciate our Tuesday chats. That's Dr. Craig DeLisi with Titus Regional Medical Center.